My name is Zoe Clark. I'm Self-Management Programme Officer here at NASS, and today I'm very pleased to be joined by Dr. Dale Webb, who you all know is our CEO at NASS. Hi Dale, how are you?
Hi Zoe, I'm extremely well, thank you. As you'll know, we've had a really good staff away day at NASS this week, and a chance for the whole team to get together for the first time in almost a year and a half, really. So it was a very energizing day, and I'm always in awe at our incredible, passionate team. So I'm very well, thanks.
Oh, I'm glad to hear that. Yeah, it was a fantastic day and nice to meet some of my colleagues that I'd actually not met in person before. It's lovely.
Absolutely.
Wonderful. I can see Lara Wiseman, who has done a Facebook session for us before, is joining. So hi Lara, thanks for joining us. So for many people watching and joining us today, you will hopefully have seen that we launched our really exciting programme, ActOnAxialSpA, on the 22nd of June in London. So I'm so pleased that Dale has joined us today to have a chat about the campaign and the programme and to answer your questions as well. So if you can only join us for part of the conversation, don't worry, because we'll be saving the video on the page and also sharing on our website afterwards as well. And please do pop any questions for Dale in the comments as we go through, because we'll have time for questions at the end. So please do pop anything you'd like to know in the comment section. So really the conversation today is going to be around the fact that at the moment, unfortunately, there's an average 8.5-year delay to diagnosis for axial SpA in the UK. And NASS have a huge target of reducing this down to just 1 year. So Dale, if you're ready, should we get started?
Yes, please.
Wonderful. So firstly, would you like to tell us a little bit about why NASS have developed the ActOnAxialSpA campaign?
Yeah, absolutely. I mean, in one sense, it's very simple. The why is that the delay to diagnosis is ridiculously long, 8.5 years, and that delay hasn't changed over time. And the problem is that we're in danger of just accepting and normalizing that people have a very long time to diagnosis. Well, why? Why should that be the case? Why can't people get timely diagnosis and relieve all that pain and anxiety and get on treatment sooner? So that's really simply why. But specifically, this came out of a private meeting I had with parliamentarians after our first meeting of our all-party parliamentary group, where they were asking me, Dale, why is there a delay to diagnosis? Can you just map out for us what the delays are and what the solutions are? And I felt frustrated that I couldn't answer the question very well, really. And then wanted to work with colleagues to develop our thinking about that. And we realized actually there's a whole bunch of things that if we did them together in a coherent way, we could achieve a 1 year time to diagnosis.
That's really exciting, and I'm sure for most people watching, who most people probably already have their axial SpA diagnosis, you know, I imagine people will be able to share, and please do share in the comments your own experiences, because you know, we do hear time and again that people have that long delay and the impact that it has on everyone's lives as well. So it's really exciting to hear that we'll be tackling this in a, as you say, in a really cohesive way. So in terms of the programme, you've identified 4 main reasons for the delay to diagnosis. Do you want to go through those areas of focus and we can chat a little bit more about those?
Yeah, sure. So I think what's distinct about the NASS approach is that we've chosen to follow the patient or follow the person from the moment of their first symptoms to the moment of diagnosis in rheumatology, and to understand where those delays occur. And simply put, there are 4 delays. The first delay is that the person has symptoms themselves, but doesn't realize that it might be axial SpA. So they put off going to see a health professional. And we know from a previous NASS survey, about 40% of people with symptoms wait more than 1 year before consulting a healthcare professional. So that's a lot of people there having a delay. The second delay is they get then to primary care, but the primary care professional, typically the GP, doesn't spot that it's axial SpA. They'll typically think it's some kind of mechanical back pain. They'll think it's because of your job or your sport. Even sometimes they say, you know, it might even be in your head, it's psychosomatic. And what happens is the GP then puts the patient on the wrong pathway. The third delay is, as you know, people with axial SpA have problems with their eyes and their gut and their skin sometimes and use those secondary care services. And patients are going to those services who've got axial SpA, who've never been diagnosed, and those healthcare professionals are missing big opportunities to identify patients. And then fourthly, even when the person gets to rheumatology, even there, from arriving in the department to diagnosis can take up to 6 months, and it should not take nearly that length of time. So we identified things that we could do to address all of those areas. So as one example, public awareness is really low about axial SpA. And we know from a recent YouGov survey that we commissioned that less than 1 in 10 people knew about the condition and its symptoms. So we've launched our campaign, ActOnAxialSpA, and a big part of that is going to be a public awareness campaign. And what we're trying to do is guide people on a journey to understanding. First, to understand there is a thing called inflammatory arthritis, and there's this thing called axial SpA. Secondly, to try and make sense of some of the symptoms. And so we've created this new acronym called SPINE to help people understand the symptoms. And you'll see the SPINE acronym on billboards, on social media, and it's very simple. Symptoms starting slowly, pain in the lower back, improves with movement, nighttime waking, and early onset, SPINE. So people see that. We then guide them to our website, ActOnAxialSpA.com. It's a symptom checker. They can go through a larger list of symptoms. And if the symptom checker concludes they may have axial SpA, there's a print off they can then take to their GP and explain to the GP their symptoms. And then our website guides them on how to prepare for the appointment with their GP and with their rheumatologist. So this new awareness campaign guides people through that entire process, but with the clear message, know the symptoms, know about the condition, see your GP, and know that if your GP thinks it's axial SpA, they'll refer you to rheumatology. And that's a significant improvement just in itself.
Absolutely, yeah, you described that, almost as a starting point, but that's a huge amount of work and a big change in itself as well. I think particularly having, sorry.
No, it is, and that's why right now we've launched the campaign, we've launched our messaging, we've launched our new video, I'm Fine, and we really encourage you, look at the video, share it on your social media channels, help us to really extend our reach right across the UK. But that's the starting point, and later, probably the end of this year or early next year, we're likely to start a regional-based pilot, maybe say London, for example, using all the underground network and all the transport systems to have advertisement that people can see publicly to really emphasize the condition, the SPINE symptoms, and our online symptom checker.
I mean, as someone with AS myself, that is really exciting to hear that. Really sort of pushing the awareness will be fantastic. And for everyone watching, we've put the links to the ActOnAxialSpA website and the launch video in the video description here as well. So after the session, please do pop back, visit those links, have a look around, and as Dale said, share them as far and wide as you can. So I suppose going back to those kind of 4 areas of delay, the second area that you described then was visiting the GP. Do you want to expand on that at all?
So of course, GPs are generalists, and they see thousands of patients with all kinds of conditions, and they don't see that many axial SpA patients. So that's true. So often they will miss the patients. But the problem is, if you want a referral to rheumatology, you've got to go through primary care. So the question for us is, how can we raise the visibility of axial SpA within primary care? And we identified numerous ways that you can do that. First, you've got to have clinical leaders in primary care who are really championing axial SpA. So that's why later this year, we're launching, I think the first ever anywhere, Axial SpA Primary Care Clinical Champions Program. And we're going to work with a cohort of primary care professionals and give them leadership support and training and help them develop local projects to raise visibility and create a national network of these people who together will be influencing local professional development opportunities for primary care professionals and raising awareness. So that's the first thing, raising awareness among clinicians and creating the clinical leadership. The second is making that primary care professionals are using the right kinds of diagnostic tools and referral tools. And again, there's been some work undertaken, led by our colleague, Dr. Rajan Gupta in Bath, developing something called the SPADE tool, which is spadetool.co.uk, aimed at health professionals. We'll be promoting that to primary care professionals. But you can also do things, you can use patient-held records in primary care to flag up people who might have inflammatory arthritis. And again, Dr. Gupta has been piloting some work in Bath, and we want to see if we can extend and roll that out. And then fourthly, we have to really work with those organizations that provide support and training to primary care professionals and help to embed Axial SpA. Now that's a lot to do, Zoe, but that's what it's going to take. If we're going to raise the consciousness of Axial SpA in the average GP's mind, we've got to do all of those things and work with people who want to support our cause. Because if we don't do that, we know this, that most of the delay to diagnosis happens within primary care. That's got to be the biggest target for us to crack through.
Absolutely, and we hear that on the helpline as well, where people are experiencing symptoms and then finding that it's difficult to get through to rheumatology and asking for advice on how to get there. So it's definitely a big area to work on. And we did have a question. Oh, sorry.
No, please go on.
I was just going to touch on sort of then the secondary healthcare, care professionals that you mentioned earlier. If someone has problems with their skin, like psoriasis and so on, and we had a question from Paula before the session about that, sort of how you will be working with other healthcare professionals to help raise awareness with them.
Yeah, no, thank you for the question, Paula. It's really important. So specifically in gastroenterology and dermatology and ophthalmology services, we will be starting to create at the end of this year a national training program to target those professional groups. So when they've got patients coming through the door, say in the uveitis clinic, they're asking the question of their patients, do you have lower back pain? And asking the spine symptoms questions. And to make those professionals think that they should be asking those patients those questions, giving them a checklist of things to be asking the patients. And then ensuring that those professionals refer directly to rheumatology for assessment and diagnosis. So we're going to develop a national training program to be implemented at a local level. And what we're hoping is that rheumatology departments will work with us across the UK to be training up, providing training to professionals in those disciplines, because that's, again, another area where we've really got to be smarter at identifying patients more quickly and getting the referral. We've already done some great work with osteopaths and chiropractors around Axial SpA. And one of the things that came out of that project were people, they were saying to us, look, I'm a chiropractor. I spot a patient who I think might have Axial SpA. I try and refer them to the GP, but the GP doesn't take much notice. But the project we developed now has a standardized referral template, and it's endorsed by the professional body, the Royal College of GPs, so the patient can take it to the Royal College, to the GP, and say, look, I've seen my osteopath, they think I need to be referred. It's those kinds of things that are going to help us to see quicker referral to rheumatology.
Absolutely, it just smooths out that pathway and shortens the time for the patient, doesn't it? And I imagine makes the GP's life easier as well when they get a clear request. They know exactly what someone's asking as well.
And there's the key word there, pathway. So NASS has been involved in some work with NHS England to develop a national referral, a national pathway for people with Axial SpA from the moment they first present with symptoms right through to diagnosis and then through to their treatment. And that work has now been completed and it's being shared with the NHS regions in England. And we want to see every NHS trust in England adopting that national Axial SpA pathway and ensuring at a local level they've got a referral pathway so they know exactly to refer from primary care into rheumatology. And at the secondary care services, they should know to refer directly into rheumatology.
And at the beginning, you mentioned that there's sort of roughly 6 months on average it takes someone to be diagnosed in the actual rheumatology service, the specialist service. Can you enlighten us about that at all, or anything the work will involve for that?
So there are numerous reasons why that is. I mean, it's the case, of course, that not all rheumatologists are experts in Axial SpA, and people do need to be seen by someone who's an expert because of the complexities in actually diagnosing the condition. Secondly, we know that sometimes, so MRI is an important part of the diagnosis process, and we know all too often the wrong MRIs are being undertaken. And we've worked with our professional colleagues, Brit SpA, who published some protocols around undertaking spinal MRIs. And we want to support the adoption of that across the UK so that the right MRIs are being undertaken in the first place. But also provide support to radiologists and to rheumatologists in actually interpreting the imaging of the patient they have in front of them and to support them. And there are various things already happening that we want to promote. So, for example, there's already a virtual imaging service, which means that if a rheumatologist has an MRI scan, they're not sure what it means, they can have it referred to a third-party expert who can look at that for them. We want to encourage more of those kinds of things. There are also tertiary referral centres where we can have patients referred to for a quicker assessment. So there are various things, even with rheumatology, that we think we can narrow that gap from 6 months to a maximum of 3 months.
Wow, that's really exciting. I imagine many people watching today will be really pleased to hear that. Based on, I can see out the corner of my eye, I've got lots of people sharing their own experiences. So thank you everyone for doing that. And I mean, we've mentioned briefly the all-party parliamentary group and the work you're doing with parliamentarians. We didn't chat about this before the session, but would you like to talk about sort of the work you're doing there and health economics and things like that, to show sort of the impact you have?
It was interesting, you know, I joined NASS at the end of 2017. At that time, NICE, the regulator, just published a clinical guideline on diagnosing and managing axial SpA. And of course, that was a great development. But when you ask the question, who's in charge of making sure that that guidance is implemented across the country? Well, the answer was nobody. Even NICE themselves only have a very small team that support the implementation of their guidelines. So that's where the idea came of maybe having a parliamentary committee. It's called an all-party parliamentary group. It's an informal committee to look at this. And I got some great advice from some members of the House of Lords who said, look, make it a very tightly defined group that will focus on overseeing the NICE guidelines. And we've been doing that work now for 2 years. We were held up a bit by Brexit and the general election, and COVID's got in the way, of course, as well. But already that group has become the go-to place, I think, for debate and discussion about diagnosing and treating axial SpA. We've looked at mental health services. We've looked at hydrotherapy services. We're about to be looking at primary care. We did a national inquiry into the impact of COVID. We did a national inquiry to show whether the NICE guidance is being used or not. So that APPG, as it's called, is really important for the work of our ActOnAxialSpA campaign going forward. And we'll be reporting progress back to our parliamentary colleagues and working with them as they table questions in the House of Commons and the House of Lords, and indeed seek meetings with ministers. Because one of the things we're hoping, as you know, there was a debate in the House of Commons in September on delayed diagnosis. And the minister who was present at the debate said, look, when COVID is over, we'll see if we can give some more airtime to axial SpA. Well, we now want to go back to her and say, okay, work with us in raising national awareness among the general public and among healthcare practitioners. So our parliamentary work is incredibly important and will be even more important going forward.
That's incredibly powerful, and yeah, just fantastic to hear that not only the progress that's already been made, but so much to come as well.
So lots to come, absolutely. And what's wonderful about all of this is our parliamentarians have really got the bit between their teeth about axial SpA. And we have the chair of the committee, Tom Randall, who's a new member of parliament. He's got axial SpA. He's incredibly committed and supportive of NASS. He was the one who led the adjournment debate in the House of Commons. And it's just, you know, it's always wonderful to work with people who are so collaborative and supportive and understand how important this is. And we're blessed to have some really good parliamentarians working with us.
Absolutely. And I was really sort of touched by the fact that through the work in Parliament, it's amazing how many MPs and parliamentarians have come forward, and they each have sort of a personal link with axial SpA as well, you know, a family member with it, or they know someone with it. So it's amazing then just to raise the profile then that it's not been done before.
Yeah, absolutely. You know, 1 in 200 people, adults, have got axial SpA. It's not a rare condition. And so it's great. You know, we've got MPs who've got partners who've got axial SpA. We've got parliamentarians who've got axial SpA. And there's something, I mean, you know this yourself, you've got axial SpA. There's something so powerful about someone with the condition talking about it themselves. And when that person happens to be a parliamentarian, it just, you know, I had tingles down my spine when Tom was doing the debate in the House of Commons, because it was his personal story of someone with the condition, but using his position as a member of Parliament to bring attention to it. Brilliant, brilliant.
Absolutely, yeah. I think you can't become more passionate about it, really, can you?
Absolutely.
That's That's wonderful. I mean, we've covered a lot of ground already. And yeah, as I said, I can see lots of people getting involved. So thank you. We'll come to your questions shortly. For anyone watching who's wondering what they can do themselves to get involved, is there anything you can advise?
Oh, there's lots. I mean, first of all, so at the moment, our awareness campaign is using social media channels. So the more that people watching this video today can use their own channel to retweet and share. So I would say visit the Facebook and Instagram pages, share the I'm Fine launch video. If you use Twitter and you tweet a lot, use the hashtag ActOnAxialSpA and join that conversation. But also come to our new website, ActOnAxialSpA.com. If you've got friends or family who you think may have axial SpA, get them to look at the symptom checker. Share the symptom checker with your social networks. We've already had hundreds of people doing the symptom checker since the launch. That's brilliant. That's the whole point. We want people to get their symptoms checked earlier. So share. But also I would say, for those of you having appointments in rheumatology or in primary care, tell your healthcare professional about the ActOnAxialSpA campaign. Tell them there are brilliant resources on ActOnAxialSpA.com that they can use to raise their own level of understanding about axial SpA. So I would say to all of you, please, we can't do this alone. Use your channels, use your network, spread the message, spread the links to our videos and to our new website.
Absolutely, and as I said earlier, I've put all those links in the video description as well, and I'll also put in the email address for people to get in contact if they'd like to with us as well. So I think we've covered a lot already. Before we get into the questions that are coming in, is there anything else that you wanted to go through?
Well, just to say that we know this is really, really ambitious, but what we're trying to do is put together a whole plan of things: public awareness, awareness raising within secondary care, creating clinical champions, supporting pathways, using parliamentary mechanisms. All of those things together give us a fighting chance of achieving this really ambitious goal. But what is just as important are the collaborations we now form with people who've got axial SpA and their families, with healthcare professionals who want to work with us. And very soon we're about to be launching an endorsement campaign. We'll be asking every NHS organisation in the United Kingdom formally to sign up and endorse the campaign and to support the implementation, because all of us together have to do this if we're going to achieve our goal.
Absolutely. Well, that's something to look forward to as well. And we've had the big launch event in London, which was fantastic. And yeah, so hopefully everyone will be getting involved and sharing that launch video as well. So yeah, is there anything in particular that comes next that you're looking forward to? Or just everything?
Well, there's lots of things coming up. So in September, we're launching our primary care clinical champions program. At the end of this year, we'll be working with professionals to develop the national training program for secondary care services. We've got the all-party parliamentary group about to be looking at the whole question of primary care and things that we can do. We'll have the next stage of our awareness campaign. So all of that's really exciting. But there's one thing in particular I'm very pleased about, which is this. We know that money talks, money influences healthcare decisions. And the big question is, what does it actually cost if you delay diagnosis? And we know bits of the answer to that, but we've never seen anywhere in the UK research that brings together all of the data on delayed diagnosis, the cost to the NHS, the cost to people with axial SpA through losing their jobs maybe, the cost to them of their out-of-pocket expenses by visiting other healthcare professionals. We've just commissioned some research that will address that question, and soon we'll be announcing who we've awarded the contract to. But probably at the end of this year or early next year, we'll be publishing the research, and it will show for the first time what each year of delayed diagnosis costs the UK economy in total. Now, that's going to be hugely powerful. We'll want to take that back to parliamentary committees. We'll want to take that to local healthcare commissioners in the country and say, look, this is the cost of doing nothing. You've got to act. And I think that will be a very impactful part of this programme.
Absolutely. I suppose you'll be talking their language then as well, won't you?
Yes, indeed.
That's wonderful. So I think if you're happy to, we'll open the floor to questions now. I can see lots of questions coming in. I know before the session we did have a question from Sarah about women in axial SpA in particular. So we know that there is a longer delay to diagnosis for women with axial SpA, and they tend to present with their symptoms differently. So is that something that the campaign is going to be covering?
Yeah, yes, very much so. So, you know, in the old days, before we had MRI scans when we diagnosed ankylosing spondylitis, about 2/3 of people with ankylosing spondylitis are men and 1. So therefore, there was this misconception that women don't get AS. Now we look at the totality of people with axial SpA, and actually it's about 50-50% split of men and women. But yes, women present differently. Women have poorer compliance with biologic therapies. So we are going to be looking at that issue, and that's very much part of the work in primary care. Even now, primary care textbooks still talk about AS as being a male disease. So a lot of our work in primary care will be about educating those professionals about axial SpA and its applicability to women. That's a very important part of this, yes. So thanks for the question.
Excellent. So Sarah, I hope that's helped answer your question. And we're also planning later this year in November, I'm going to be having 2 separate Facebook Lives with a consultant rheumatologist and a rheumatology physiotherapist looking at men and axial SpA and women as well. So we'll be able to cover those differences too. And just seeing lots of people commenting, thank you for all the work you're doing. It's really exciting. And Lara shared her experience that she said it took over 10 years to diagnosis and then another 10 to get the right doctor to prescribe the right medication. And it's, you know, it's just awful hearing things like that, you know, if only we could turn back time, but at least from now going forward, hopefully we'll be hearing that less and less.
Yes, I want those things to become a thing of the past, really, and that's why this is just the most critical thing that we're doing right now.
Absolutely, and Joy says thank you for all you're doing. She's had pain since the age of 21 and just got diagnosed last year, aged 47. That was a long wait. And Julie sort of commented about the fact that sort of once you get the diagnosis, you're left to deal with the complications of this disease. I mean, we're doing a lot of work in, you know, through our Facebook Lives and different sort of projects to help support people once they do have that diagnosis. So I don't know if you have anything you want to share on that line as well.
Yeah, no, absolutely. I mean, so when people get their diagnosis, we want to make sure they live the best lives they possibly can and live well with the condition. And we know right now, in the context of the COVID pandemic, so many people haven't been able to access rheumatology departments as they have been. And you know, obviously, Zoe, from the helpline service, we've been deluged, I mean, for a year and a half now, with people who can't get appointments, who are in distress and pain. And so therefore, self-management becomes really, really important. And since the pandemic started, since you started these Facebook Live sessions, it was April last year, we've now been building up a series of resources to help people live well with the condition. We've built up the My AS, My Life webpage, and we've been piloting, you've been piloting some self-management sessions in collaboration with rheumatology departments. Going forward, I think self-management becomes more important than ever. And I say that because there are also some worrying concerns within rheumatology about the rheumatology workforce. There aren't enough people coming into that discipline. And even last week, there was a report published on that. So people being able to manage themselves well in the most optimal way they can becomes so, so important. And NASS is completely committed to really strengthening over the next few years our self-management support so that people feel they've got the resources and the peer support networks. And of course, don't forget our incredible NASS branches who do amazing jobs week in, week out across the country, supporting people in friendship, but also through physiotherapy and hydrotherapy. All of that is so important.
Absolutely. And in fact, the next comment that I saw was Anya saying how amazing their local NASS group was and the amazing physios as well. So definitely a good opportunity to say thank you to everyone who runs those branches.
Very much so. And no, just very much so. And also, of course, you know, the branches themselves had to figure out in the pandemic, what did they do when they couldn't meet physically? And so many branches were doing virtual sessions. And I really applaud our branches for, you know, keeping going and the work they've done to keep people connected to each other, which has been so important in this really stressful time we've been living through.
Absolutely. And Anya said they got diagnosed relatively quickly, 18 months after their father had AS, and said, could it be AS? So I suppose that's the thing with this campaign, is being able to raise the awareness and get people just more frequently and earlier saying, could it be axial SpA? And yeah, we've got a few more comments to the people who are asking about their sort of pathway to diagnosis. Please do feel free to get in contact with us on the helpline, and we can have a chat about that and see if there's anything we can advise. Yeah, I've got quite a few comments saying thank you as well, and a few long comments describing people's experiences, so we'll definitely come back and have a read through those as well. And Julie's commented about the mental health impact because of the pain from axial SpA as well, and that's something we've touched on already, isn't it, in our work?
It is. I mean, we know already that the percentage of people with axial SpA who have mental health problems is much higher than the general population. And one of the concerns we have is that within rheumatology, and partly because of the pressure of the time on the consultant, but just partly the consultant's thinking about the person's physical health and not the whole person. But people's mental health is so important. I mean, you and I were talking about this earlier this week, Zoe, on it's distressing when we see callers with real emotional health problems, or indeed feeling suicidal at times. And this is an issue which I think isn't talked about enough, the mental health aspects of axial SpA. We held a meeting of the All-Party Parliamentary Group to look at that question earlier this year. And what we want to try and do is to work with NHS organisations to say, look, how can you help to build the business case in your local NHS trust to have a psychologist as part of your rheumatology team, so that mental health issues are much more in the mindset of the team supporting the patients with axial SpA, that those patients are assessed for the mental health routinely on their appointments, and they get access to psychologists within the team who can support them. That for me is the gold standard we need to be working towards, because otherwise this is a huge burden that isn't being properly addressed by the NHS at the moment.
Absolutely, I couldn't agree more. And yeah, seeing lots of comments. Jane Halliday saying just love what she's hearing. Thank you for everything you and all at NASS are doing on our behalf. So yeah, it's obviously really important to so many people watching. I
mean, it's really kind to hear, but I would say, one of the things I've loved, I love many things about being chief executive of NASS, many things. But one of the things I really love is just how vibrant and energized the axial SpA community is. People are so willing to be involved in, research projects, or be case studies for us, or share their stories and commit to sharing on social media, all of this stuff. That's brilliant. And I just applaud all of you for the work that you do, because without you, we couldn't do the work by any stretch that we do at NASS. So I think together, we're an amazing community of people, actually.
Absolutely, and I think especially for people who have had a long time waiting for that diagnosis and really struggled with their pain and fatigue and all different symptoms, when you then get that diagnosis and you then get access to this whole community of support and cheerleaders, I think it makes a really big difference.
It really does, and of course, it's really even more energizing and motivating for the NASS team, knowing that people are supporting us and working with us.
Absolutely, yeah. So I think we've covered all the questions that have come through there, but I will pop back into the comments afterwards and make sure we've not missed anything and answer any if we have. Was there anything that you wanted to add before we finished up the conversation, Dale?
Just to encourage people, please share the video, share our social media feeds, go on to ActOnAxialSpA.com, share the information with that people, help to generate some interest in the work that we're doing.
Wonderful. So before we finish up, I'll just say to everyone watching that our next session is next Thursday at 1 p.m. and I'll be joined by Professor Carl Gaffney for his previously postponed session all about the different areas of pain that you can get with axial SpA and the other conditions like the psoriasis and uveitis we mentioned earlier. We'll be talking about why this happens with axial SpA, but also giving you advice on helping to manage those as well. So please do come along to that. So thank you so much, Dale. I know you're incredibly busy, so really appreciate your time today. And yeah, just really looking forward to seeing all the work come together.
Thank you everyone for joining.
Thank you everyone for joining and see you next week. Take care.